ICUs in Minnesota are nearly full. At this moment, 96% of beds are taken. Good evening. Thank you for joining us tonight. I'm Amy Hawker.
And I'm Kelsey Carlson. Hospitals are stretched thin among a surge in COVID cases. Courtney Godfrey joining us now with the very latest with those numbers. Courtney?
Yeah, Kelsey, I got some time with the CEO of Hennepin Healthcare today, the woman in charge of the state's safety net hospital and the busiest emergency department in Minnesota. She told me it's not beds, space, equipment, or ventilators that has them stretched. It's staffing.
20 months of running at the pace that our teams are running is a lot.
Since July, COVID hospitalizations in Minnesota have only been going up as healthcare systems deal with one of the worst labor shortages in history.
What you're seeing is people are exhausted, so they're choosing to retire. They're choosing to go into other professions, leave healthcare altogether.
Hennepin Healthcare CEO Jennifer DeCabelis says they've lost a couple hundred workers amid the stress of the pandemic. And with a steady rise in cases the last 90 days, that loss is magnified.
Really, just the whole system is feeling the high bed demand at a time when we don't have the workforce to even respond to that.
So I'm looking at it as a treadmill that just sped up a lot.
The Minnesota Hospital Association says with every healthcare system feeling the pinch, they're exploring how they can build pipelines of talent into the industry before it gets worse.
We are thinking hard about what can we do to attract the right talent.
While hospitals focus on a pandemic that seems to have no end.
When all of us are feeling the pressure at the same time, you don't have a place to decompress.
DeCabelis says the one thing all adults can do to give these healthcare workers a break is to get vaccinated. At this very moment in the Twin Cities metro, there are only 6 ICU beds available. Amy?
All right. Thank you, Courtney.